call this hearing of the Senate Communications and Technology Committee to order, and I would like to welcome everyone to this hearing to discuss the Department of Health's new contact tracing mobile app for COVID-19. I'd like to turn this hearing over to Chairman Carney for some brief opening remarks. Chairman Carney.
Good morning. Thank you, Chairwoman Phillips-Hill, for holding this hearing on a timely and critical issue towards keeping us all safe. I want to thank all the testifiers here today, particularly our friends from the Department of Health. They are ground zero, and we deeply appreciate their expertise and guidance during these unprecedented times. Emergency preparedness is critical at all levels of government. Thankfully, our preparedness information has moved beyond Farmer's Almanac to highly sophisticated weather prediction models through satellite and other technologies, resulting in more lives and communities saved. The sooner we get information, the better we're able to prepare and save lives. This virus has proven dangerous, persistent, and deadly. As of Sunday, the Department of Health reported on their website 139,316 cases in Pennsylvania. We continue to see hundreds of new cases each day. While we now know more than we did even a few weeks ago, we continue to battle an elusive virus smaller than anything we can imagine that travels unseen through the air. And make no mistake, this pandemic is ongoing. A vaccine is still many months away. Preparedness in this new time requires a multi-pronged approach. Technology that lets us know if we've been exposed will greatly improve our odds of preventing further spread. It is incumbent on us as elected officials to follow sound public health guidance while protecting individual privacy in an attempt to stay ahead of what could be multiple waves of COVID-19. Today, we have an opportunity to hear from the Department of Public Health about an exposure notification app developed in partnership with Google, Apple, MIT, and Penn for 4 states that include Pennsylvania, as well as New Jersey, Delaware, and New York. Now, we are deeply concerned about privacy. This newly developed exposure notification app is an exciting opportunity for interested individuals to opt in to receive exposure notifications while not compromising personal information or location. As you will hear, this is not your standard GPS app. This new approach uses highly encrypted, low-frequency Bluetooth key codes to alert those who have opted in if they have been exposed to someone who has tested positive if they're within 6 feet for at least 15 minutes. Previous versions of contact tracing have relied on the memories of those testing positive to remember where they've been and to know the names of who they've been in contact with in an elevator ride or a crowded post office. Most of us can't remember what we had for breakfast, let alone all the people we came in contact with 10 days prior. As you'll hear this morning, by using this new technology, we can help fill in the gaps through electronic exposure notification that traditional contact tracing can't. Now, I'm an architect. I'm not a public health professional or a software engineer, but I am used to relying on experts in their fields in order to get a complex building built. Now, I'll turn this back to Chairman Phillips-Hill so that we can get on with the hearing. I want to conclude by saying I'm confident that we can beat both our privacy and public health pandemic management goals by working together. My apologies in advance if I have to duck out to attend an event with the governor, but I will rejoin you for the second half of the hearing. Thanks again to all of you attending today's hearing, and I look forward to hearing from the testifiers. Thank you very much, Chairwoman.
Thank you, Chairman Carney. Again, I'd like to welcome everyone to this hearing to discuss the Department of Health's new contact tracing mobile app for COVID-19. In light of a recent announcement by the Department of Health to launch this new mobile app for COVID-19 contact tracing, I knew it was imperative on us as the General Assembly to make sure we knew exactly how this is going to be rolled out and what exactly is going to be rolled out. As legislators, we are responsible to our constituents to answer their questions about taxpayer-funded projects of all kinds. Despite this responsibility, the General Assembly has had almost no input in various mitigation measures for COVID-19, including the development of this new contact tracing mobile app. I think it's incumbent on us to glean as much information as we can about a state-funded phone app that's going to put out to the masses that could have a major impact on data collection of the public. Data privacy and collection are too important to not ask questions. We owe that to our constituents. Further, to engender the trust of the general public, we need to assure that this is a voluntary program, and that if an individual consents to participating in this program, this mobile app, they know exactly what they are consenting to. Today, we will hear from the Department of Health regarding the actual specifics of this new mobile app, so that we can go back to our constituents who have expressed concerns. Additionally, we will be hearing from the ACLU of Pennsylvania and the Mercatus Center at George Mason University. It's important to understand best practices from these organizations when it comes to contact tracing, and also what other states are doing in this area so that we can ensure that we have the best product possible. I believe this will be an enlightening information-gathering hearing about contact tracing generally and the protections that are in place to ensure the safety of those who utilize this app and these systems. I'd like to now move on to our first panel. Joining us for the hearing from the Secretary of Health, the Department of Health, is Megan Patel, Deputy Secretary for Health Innovation at the Department, and Lindsay Malden, Special Assistant to the Secretary at the Department of Health. We will start with your opening remarks, and we'll have plenty of time for all members to ask questions.
Thank you. Good morning, Chairwoman Senator Phillips-Hill, Minority Chairman Senator Kearney, and the committee members of the Senate Communications and Technology Committee. My name is Meghna Patel. I'm the Deputy Secretary for Health Innovation at Pennsylvania Department of Health. In my non-COVID-19 responsibility, I oversee Pennsylvania Prescription Drug Monitoring Program, Health Research Office, Bureau of Managed Care, the Rural Health Redesign Center, Primary Care Office, and the Bureau of Health Statistics and Registries at the Pennsylvania Department of Health. As the COVID-19 pandemic hit, in my COVID-19 responsibility, I am tasked by our Secretary of Health to assist in contact tracing and testing efforts. Before I get into my presentation today, I'll give my floor here to Lindsay, who's my colleague, who will introduce herself.
Thank you, Deputy Secretary Patel, and thank you everyone for having us today. My name is Lindsay Malden. I am a special assistant to Dr. Levine on contact tracing. I joined the department in May and have come on and joined our county and municipal health departments along with our community health nurses across the Commonwealth to think through the expansion of our contact tracing efforts in the state. This includes the mobile app, but also includes the hiring and training of additional staff members that will bolster and diversify our public health workforce, while also helping us to respond to this pandemic. I'm happy to answer any questions today about the work that we're doing to expand our infrastructure at the Pennsylvania Department of Health to meet the needs of contact tracing through COVID. And I'm happy to talk with all of you today.
So, committee members, this is Meghna Patel. I do have a presentation. Whenever the committee is ready, I can share my screen.
Ms. Patel, we are ready for you to share your screen. Thank you.
Great. Give me 1 minute here. I'd like the host to allow me to share the screen.
Ms. Patel, in this format, I'm told that we are not able to share screens. So I have to apologize and would ask that you summarize your testimony. Members have received a copy of your testimony, which is a PowerPoint presentation that was very well done, and really appreciate the work that you put into this. There's copious amounts of information in here, but I would ask if you could please summarize it and provide verbal testimony. Would really appreciate it. Thank you.
Yes, that's absolutely fine. I'll just go through some of these screens here myself, projected on my computer here. Please don't mind, I'm moving my face from one end to the other because I have multiple screens here. So good morning again. It is my pleasure to present a novel technology solution in front of the committee today. For the ease of understanding how the technology and the app works, I did prepare a presentation with my team here, and it's being shared with the committee. Apple and Google, back in May of 2020, announced a joint effort to use the Bluetooth low energy technology that currently all smartphones have. They wanted to leverage this technology to help and support the traditional contact tracing. Now, Bluetooth is the only technology that's used here. It is the same technology that is used to connect a phone to a car when someone wants to listen to music. And this wireless technology can help calculate time and distance. And based on that proximity, one can get alerts if they come in close contact with someone who gets tested positive for COVID-19. This is a opt-in and voluntary app, but now we have, in a way, an additional tool in the toolbox, which has the potential to save lives for COVID-19. There's absolutely no location or GPS or geolocation used here. The phone doesn't even enable that, and there's no means for the app to collect this information. So when this was first announced by Apple, Google, they were very clear that exposure notification must comply with the strict privacy standards. Only state public health departments or country's public health agency can develop such an app. Pennsylvania has used contact tracing as a tool to stop the spread of infectious diseases for decades. And I'd like to walk you through sort of a very high-level example of where exactly this tool could be efficient. So today, our disease investigators reach out to every single positive case individual in Pennsylvania and try to understand who they came in close contact with. This is done so public health can reach out to the close contacts and alert them saying that they might have been exposed. So they can monitor themselves, get tested, stay at home, and take precautions. Basically, they effectively try and slow the spread of COVID-19. But here's a sort of a problem that we were trying to solve with an exposure notification app. During these disease investigation calls, a positive COVID-19 individual could only name their family members at home, potentially their neighbors, or even extended family or friends when they try to recollect who they came in close contact with. If this positive COVID-19 individual went to a grocery store or a food pickup line or a pharmacy store and interacted with a stranger, probably not social distance, whom he, she, or they cannot identify or provide contact of, then that stranger who came in close contact with the positive COVID-19 individual had no idea that they were exposed. So this individual will go out and about carrying their routine work, completely unaware, and continue to spread the virus. So as you may have seen in my slides here, it's depicted in this graphic. Not all close contacts are identified, especially if they cannot name their strangers, the strangers or recollect who they came in close contact with. So when this novel technology was released by Apple and Google, I wanted to share with you all what we did here in Pennsylvania. So we reached out to the Australia, Singapore, Ireland, and Germany's health departments since they were ahead in developing such apps. Very clearly, we learned that Australia and Singapore are not using Apple and Google's privacy-centric exposure notification service, while the countries that advocate the most on data privacy were implementing the Apple and Google's exposure notification service and developing their own country-specific apps. Ireland and Germany are considered gold standards of implementing such a technology. Ireland has about 37 to 40% of their population downloading the app, and Germany has about 20 to 22% of their population downloading this app. Now, here in the US, in the absence of a nationwide app, states started to research and develop their own respective exposure notification apps. And here in Pennsylvania, we kickstarted multi-state coordination calls with all of our neighboring states. From that, we partnered with Delaware and 2 other large Northeast states. We partnered with Nearform, who is the app developer of Ireland, Northern Ireland, Scotland, and Gibraltar government. Nearform was the only app developer in our evaluation list that had experience launching an exposure notification app using the Apple and Google API. Experience was one of the selection criteria for us. It is a novel technology implementation, and truly experience big matter to us. Nearform has also proven to be successful with the countrywide launch. As I said, they launched in 4 other countries. Nearform is also open source their code and are licensing under the Linux Foundation, which speaks about the highest level of transparency and collaboration on their part. They are the only app developer that has shown a successful country-to-country interoperability in terms of Ireland and Northern Ireland. We then also partnered with academic partners. So we brought in University of Pennsylvania's Center for Health Incentives and Behavioral Economics Group, who, with their expertise and experience in behavioral economics research, we wanted to ensure that they help us with community marketing and messaging efforts, understand the social media misinformation, public concerns, and any other related insights to inform messaging and user engagement, conduct any pilot testing to evaluate the user adoption. And through the sponsorship of the CDC, we got in partnership with MIT's Lincoln Lab, their Computer Science and Artificial Intelligence Laboratory, and Internet Privacy Research Institute. And they've been advising us in Pennsylvania and some other US states that are adopting the automated COVID exposure notification app here. They're also our technical advisors, and they're also conducting our security and privacy assessment. And finally, to avoid having residents to our respective states, of our respective states, to download 50 state-specific apps, Apple and Google, along with some of these states, are working here with the Association of Public Health Labs, who has developed a national interoperability platform, which will allow seamless interoperability between states. So if I'm traveling to New York, I don't have to download New York's app. Pennsylvania's app can work seamlessly in the background with New York's using the APHL platform. I do want to quickly walk through a short example of how this technology works. And I apologize, I can't project it, but I know you have the slides. So I'm talking about the 2 graphics that are on slide 2 and 3. I usually like to take myself or someone else on the call as an example, but in this graphic, I'll take Bob and Alice as an example. So for this example, let's assume that Bob and Alice are strangers. They both have apps on their phone. they're within 6 feet and talk to each other for 15 minutes or more. In the background, the two phone devices exchange a Bluetooth handshake, which is nothing but random alphanumeric values. In other words, people call it Bluetooth keys or chirp. After that interaction, they go back to their normal life. A few days later, Bob tests positive. Bob talks to a public health case investigator, uploads a 6-digit validation code provided by the public health case investigator that confirms that Bob was actually positive through the app. As Bob confirms this through the app, his alphanumeric values, the random Bluetooth IDs, were flagged as positive. And because Alice also had the app and Bob had met her in the past, who she was, and they were in the 6 feet and spoke with each other for 15 minutes or more, Alice will get a notification that you came in close contact with someone who was recently tested positive. And through the app, there will be public health advice provided to the individual who got the notification. If Alice is now very worried that she got the alert and she wants to speak to a public health representative, we also give an option for Alice to provide her number for callback. So this is a very simple, and we can see that if Bob was interviewed by contact tracing, he wouldn't have remembered Alice's name as a stranger, and neither he would have her number, or he could recollect that he was in close contact with someone. So this tool helps, in a way, all of us to fight the spread of COVID-19 pretty rapidly. I'll just briefly touch upon the limitations of Bluetooth, and then I am pleased to present the app demo, or else I'm pleased to also address any questions of the committee at that time. So Bluetooth is a wireless technology. It reacts differently in a different environment, especially in a metal environment. It shows us that people are much closer than they are. So a greater study was done in Trinity College in Dublin, Ireland, and they concluded in that study, after testing Bluetooth in all the different type of real environment settings, that even though in the metal environment, such as a bus or a subway, where the doors and windows are pretty closed, it is best to err on the side of caution to show, even though they are not 6 feet apart, to show that they are close enough, just because of the indoor setting and the spread of the virus, that those alerts would be still appropriate. The Bluetooth and the app also does not know if someone is wearing a mask. The Bluetooth and the app and the device also, if they're placed, the phone devices, if they're placed on the desk or on the table together, but the phone device owners are separated from each other 6 feet apart, the Bluetooth is also, and the app is also not aware of that. And then finally, we all know that we have to, at the Department of Health here, and in partnership with other agencies, we do have to work a lot on the public trust of this technology, especially because there's a lot of misinformation out there about what the exposure notification app does and does not do. Early on, when the exposure notification app was announced, a lot of states and countries came up with contact tracing apps that collected GPS and location-based information. And I wanted to emphasize that this is absolutely not what it does. There's no way for this app to collect that information. So I will pause here, Chairwoman, if you have any other questions for me.
Thank you, Deputy Secretary. And a question for you. And you referenced this, and that is public trust. Public trust is essential. And as Pennsylvania's Department of Health has made the decision to go down this path of technology-assisted contact tracing, we really need to ensure that there are safeguards to prevent the violation of individuals' civil liberties. And one of the first concerns, of course, is this app voluntary?
Yes, this app is completely voluntary.
And I am
The
told
app
that
user,
when people go into their phones, that this app has been downloaded onto their phones. Is that correct?
so both Apple and Google have released a software that enables exposure notifications. It's called Exposure Login. It's in the phone settings, and people can absolutely go into the phone devices and opt in or opt out of the exposure notification setting.
So the software is put onto phones of people whose cell phones are registered in Pennsylvania, and you have to affirmatively opt in or you have to affirmatively opt out.
Yes. So this is
No,
actually
it's a
globally.
yes or
It's
no
not-
question. Do you have to affirmatively opt in? Do you have to turn it on, or is it turned on and you have to go in and turn it off?
It is. You have to, as a phone user, need to turn it on and off.
Okay, so if it shows up on my phone, it's not on until I turn it on. Is that correct?
Absolutely, yes.
Very good. I would like to turn the questioning over to Senator Ament. Senator Ament?
Does not have GPS location capability. And again, I just want to ask you directly about that, that the app does not have GPS location capability now or at any foreseeable point in the future.
Yes, that's absolutely correct. The app and the technology does not have any means to turn on or enable GPS location and will not be used for that purposes in the future.
Thank you. I also want to follow up some questions with respect to how the data is being utilized. I think it's fair to say there are many residents who are concerned with giving government access, potentially, to information that would be a violation of privacy and using the data for the purpose of centralized government action, such as issuing or enforcing quarantine orders or other punitive measures. So can you provide an overview, again, how the data is being utilized and that the app will not be utilized for the purpose of issuing or enforcing any centralized government decisions?
That's absolutely accurate. So data, I would love to show you through the app demo what exactly and precisely we're collecting. But information sort of processed in the app is collected in three different ways. So there's information that is provided by the app users, and that is all based on the symptom check-in feature. And the symptom check-in feature is optional. It is also collecting aggregate information. There's absolutely no personally identifiable information collected in any way through this app. There's also the data that is generated by the services on the phone. So early on that I talked about how if people download this app and they opt in and turn on the exposure notification service, which turns on the Bluetooth, it only generates random IDs, the Bluetooth identifiers, which are nothing but alphanumeric random values. So that is also generated. So anything that we're collecting here, even in terms of the app usage data, which is nothing but understanding if someone had a breakdown on during the onboarding of the app, whether the app was deleted, whether they had a crash when downloading the app. That is all just performance metrics to understand if the app is functioning well or not for the user. So that is the only type of data and information collected here.
Thank you for that. And then finally, what is the life cycle of the data? And once the data collection or the app is no longer relevant, is there a plan in place to destroy the personal data that has been collected?
Yes, absolutely. So even per our federal and Commonwealth IT standard processes here, the aggregate data, once we do not need it, is safely and securely removed from the servers and the data warehouse here.
Okay, thank you, Madam Chair.
Thank you, Senator Ament. If I could please follow up on Senator Ament's questions with response to the data and what eventually happens to that data. You indicated that once we don't need the data any longer, it will be destroyed. Is that correct? What?
Yes, that's absolutely accurate.
How is the determination made that we no longer need that data?
There are multiple pieces of data, like I mentioned earlier. There's symptom check-in feature, which collects nothing but anonymous sort of information, aggregate information on general symptoms of Pennsylvanians that they choose to self-monitor and self-use the feature for. That data is just used for public health analysis to see where we're seeing uptakes of COVID-19 symptoms across Pennsylvania. The second piece of data that we do collect is the app usage data, and that is used to understand if the app is performing well or not. These two pieces of data, as we trend upon and embark upon having this app until such time we have vaccinations or the pandemic is not applicable, or we don't see a public health crisis here, we will sort of sunset all of that data collection and follow the Commonwealth and federal here policies in terms of removing that data.
So you don't have a specific target. You don't have specific criteria for when you will stop collecting this data. It sounds like you acknowledge that you'll stop collecting it, but you have no hard and fast stop. You have not identified the metrics. When we reach this, this app will stop collecting data.
Yeah, usually per the Commonwealth standards, I believe it is up to 7 years that usually the information is retained. We here, based on our program internal controls, we'll be determining if we need this data to keep here for more than a couple of years. It is very likely that we will remove this data within the next 2 years, as we don't see this app, hopefully we don't see this app to be used for more than 2 years here.
Thank you. I'd like to recognize Senator Costa for questions.
Thank you very much, Madam Chairwoman. Just a very brief question, just so I have some clarity. So we are now engaged in the latest emergency declaration. The maintaining of this program will continue beyond the expiration of the declaration, if I'm not mistaken, and you're indicating maybe up to a period of time of 2 years. Just so I'm clear, that's what the plan is at this point in time?
So I certainly can explain this in the way that, I first of all, we're in the global pandemic. The virus is sort of determining the trajectory here. If we absolutely feel that this app is not needed, that we're able to not use these features and functions of the app, such as the exposure notification, people don't need the symptom check-in feature, we would absolutely make that determination that we don't need this app. But at this time, looking at the global pandemic scenario of planning and helping the contact tracing efforts, we do see the need at this time for this app for at least such time we have the vaccinations or all the other mitigation strategies and control of the global pandemic here.
And very briefly, that would be a decision made collectively by the Department of Health and by the Secretary at some point in time, and as they're under the authority of the Disease Control Act, or I'm just trying to see where the authority would come to and what processes would be in place, or what do you anticipate being in place as you go through the thought process that now's the time to terminate. You may have answered that, but I just want to maybe reaffirm that if I could.
Yeah, I mean, global pandemic is determined by the World Health Organization, and here at the federal level, the CDC also determines the pandemic scenario and public health crisis. In Pennsylvania, we certainly look upon our Secretary of Health and the governor to determine the public health crisis. So dependent on all these factors, the extension of the app, whether we need it in Pennsylvania, will be determined.
Thank you, Senator Costa. I'd like to recognize Senator Hutchinson for a question.
Thank you very much. I have two questions revolving around the usage of this information. And the first one, I was wondering if, and I've had constituents raise this question with me about whether their willingness or unwillingness to use the app will have any effect on their ability to A, get tested to see if they are infected, or B, on the back end to be able to get treatments, vaccination, for example. Will the criteria that a constituent uses this app be used against them in any way to stop them from A, getting tested, or B, to be able to get a vaccine if and when that is developed?
So the answer is absolutely no. This will never be a barrier for any Pennsylvanian to get treatment or get tested for COVID-19. The app is essentially made for public to alert them if they were in close contact with someone who recently tested positive for COVID-19. The app is for constituents and Pennsylvanians to use it for their personal sort of symptom checking management. And the app is also provided to them to look up the Pennsylvania numbers and updates around number of cases, the number of deaths and hospitalizations, so they can be informed. The app in no way or means is structured to collect information to use that against the constituents. It is absolutely a choice. It is opt-in, and it is for them to get alerts if they came in close contact with someone. So it is sort of an alerting system. What it's meant to do, what it's supposed to do, which is exposure notification.
Along the same lines, will the information gathered by this app be used for enforcement actions against, say a restaurant? For some reason, this app found multiple people infected at a restaurant. Does that mean the Department of Health is going to sanction that restaurant, close it down, fine them, any of those kinds of enforcement, legal enforcement actions based on information gathered by this app?
Not at all. Absolutely not at all. So the app or the technology never turns on or uses any of the GPS or geolocation or any location information. So the app doesn't even know, the technology doesn't even know about that. And it is not going to be used for any of this sort of enforcement purposes at all.
Thank you. That's all the questions I have at this point.
Thank you, Senator Hutchinson. If I may, what organization will be performing an audit and risk assessment at designated intervals on how the Commonwealth is using the data it collects? Whether it's efficient, whether it's effective, if it's staying within the delineated parameters that are outlined in the comprehensive plan, avoiding breaches and government overreach, and conforming to the public's trust.
Yeah, absolutely. I can explain the sort of a process. So we're most welcome here to share the IT application sort of hosting requirements per Commonwealth hosting and security requirements. But prior to the app launch, an independent third-party security and privacy vulnerability assessment will be completed. And after the assessment concludes successful outcomes, only then the app will be launched. Now, alongside, we also have national experts. Like I mentioned, we have MIT Lincoln Lab, their Computer Science and Artificial Intelligence Lab, their Internet Privacy Research Institute, and they are conducting a privacy and security assessment of the exposure notification service and the COVID Alert app. I'd also like to mention that countries and U.S. states that have went live with the exposure notification services have also conducted their own independent data and privacy security assessment. And they are all made available for public for review and feedback. And our goal here is to ensure that all this information is transparently available to public. So we will ensure that this public understands in simple language what is done through this app and the technology, and how private and secured it is.
Thank you. I don't believe you really identified who would be doing that assessment. Now, you indicated that MIT and they have a spin-off from their research entity called PathCheck. And PathCheck has a relationship with Nearform. So essentially, these are all the people who helped create this, who are working to assist the Commonwealth in running it, and then you're saying that they're also going to be the individuals that audit it. That's not essentially a third-party audit.
Yeah.
Do you see what I'm saying? So is there an independent entity who's not been involved with the creation, the development, the running of this app, who are going to come in and do an independent audit of these things?
Yeah, so there are two multiple things that I would like to highlight. First is that the independent third-party security and privacy vulnerability assessment is a Commonwealth IT application procurement requirement. That has been it's already in the process, and we will soon be able to see those assessment results before the app launch. The second piece is that the MIT Lincoln Lab, with their Computer Science and Artificial Intelligence Lab and their Internet Privacy Research Institute, is separate than PathCheck, which is a PathCheck foundation from MIT. They're two different organizations, sort of in a way, within the MIT structure. So the MIT Lincoln Lab structure is the one who is also conducting the privacy and security assessment, and they have been funded by the CDC to conduct this assessment.
So I'm assuming that there are memorandums of understanding, contracts, RFPs, non-disclosure agreements, similar types of documents that are memorializing all of these different relationships.
Absolutely. So we do have, through the CDC, we certainly have the scope of work listed out of what MIT Lincoln Labs needs to do in terms of privacy and security assessment. And through our IT application procurement, we've clearly identified what Neoform needs to do, which is getting a third-party privacy and security vulnerability assessment.
And then, just lastly, in order for any contact tracing to be effective, there can't be delays in testing or testing results, or delays in reaching out to individuals who are infected. So if an infected individual does not hear from the department for several days, then that mechanism of contact tracing would be in effect worthless, correct?
Not necessarily. It is optimal that they are contacted right away. However, our Commonwealth of Pennsylvania contact tracers and our case investigators do an excellent job in reaching out to all the positive cases within the 24 to 72 hours time frame. In order for this particular technology to be helpful, if these positive cases and individuals have the app onto themselves and also agree to accept a 6-digit code from the Department of Health, they will be able to help and alert the individuals that they came in close contact with in those past 14 days. So it is still helping out. Certainly, we here at the department, we would wait for lab results to come here in a rapid manner to be able for us to conduct all those case investigation and contact tracing efforts. And I'd like to see if Lindsay, if you have anything else to add, since Lindsay here, our special assistant, is also leading the contact tracing efforts in Pennsylvania.
No, Magna, I don't think I'd add much except for the fact that what you said is accurate. We definitely still find value in reaching out to those folks and asking them to quarantine, and also having a conversation with them about keeping their communities and their families safe. So we definitely still would do contact tracing in those circumstances, and want to make sure that those folks have the resources they need to be able to quarantine.
So currently we're seeing large spikes in York County, and I am hearing from physicians in York County that patients with positive results have never been contacted by the Department of Health. You know, when you testify that someone will be in touch within 24 to 72 hours, what are you doing to ensure that the current system is working before you actually implement a new technology system?
And Magna, if you don't mind, I'll start, but I think we are absolutely responding and working to expand this infrastructure as we operate it. And so we are working to identify any gaps like those that you name in York, and I'm happy to check in on those specifics as well. But what I can say is that while we also build to expand the infrastructure, it's important to also look ahead and think about technology or tools, like Magna said, in our toolbox that might be able to complement or supplement those efforts.
Well, and that gets me back to Ms. Patel's testimony. She talked about the fact that, you know, we had Alice and Bob, and Bob's positively diagnosed. Alice receives that notification on her phone, and Alice's phone then receives a notification with information about what to do next. That what to do next is concerning, again, in York County, in that I'm being told people have to wait a significant amount of time to receive a test, and then a significant amount of time to receive the results of a test. And we're hearing stories of Constituents are reaching out saying, I had same-day testing and results in Maryland. They're slipping over the line to other states that we're not, I understand, working with, because they can get that information that they need. Of course, because for a lot of people who don't get paid if they don't go to work, being quarantined for, I believe it's still 14 days, is impossible. Can you speak to that? I sent a letter to the Secretary of Health on August 14th discussing this very concern and have yet to receive a response.
Madam Chair, this is Magna Patel. I would be pleased to work with Lindsay and other team members here at the Department of Health to look closely into that letter. But like Lindsay mentioned, this is one tool in the toolbox to help with the response here and curb the pandemic of COVID-19. Even the studies done abroad with the Oxford University and Stanford University here, this is a novel technology. Even if there are exposure alerts sent out to individuals that are missed in terms of contact tracing, who we know that the cases don't remember or cannot recollect, during that case investigation and contact tracing process, it does help in terms of getting them alerted of their exposure, getting them a public health advice. If they develop any symptoms, at least directing them to their healthcare provider or the nearest sort of testing site for COVID-19. But we would be pleased to look into details of your correspondence here with the Secretary of Health.
Thank you. I appreciate it. I thank you both for participating in today's hearing. And we will now move on to our last panel of the day. And joining us for this part of the discussion is Elizabeth Randall, Legislative Director with the ACLU of Pennsylvania, and Brent Skorup, Senior Research Fellow at the Mercatus Center at George Mason University. And again, we will start with your opening remarks and then have members ask questions after your remarks. So, Elizabeth.
Good morning.
Morning.
Good morning, Chairwoman Phillips-Hill, Chairman Carney, and members of the Senate Communications and Technology Committee. I'm Elizabeth Randall. I'm the Legislative Director for the ACLU of Pennsylvania, and just wanted to thank you all for inviting us to participate in today's hearing. I'm going to be sort of going through I had sent you all a longer version of my testimony, but I have attempted to significantly pare it down for today's hearing, and will of course be happy to answer any questions following my presentation. So, having defended privacy for 100 years, we at the American Civil Liberties Union recognize that in extraordinary times, different balances between public health and personal privacy may be warranted. The coronavirus poses grave risks, so we should not write off tools that might help stem the pandemic. But we shouldn't give up critical rights and freedoms unless a proposal is necessary, effective, and proportionate. We are particularly wary of technological solutions that would interfere with or divert resources away from public health solutions with proven effectiveness, or that risk exacerbating existing disparities that have already led to inequitable health outcomes. Any uses of technology should be temporary, be restricted to public health agencies and purposes, and allow for privacy and anonymity to be protected. Programs designed to track the spread of coronavirus include traditional manual contact tracing, technology-assisted contact tracing, and hybrid models. The ACLU of Pennsylvania recommends 6 steps when considering the use of a technology-assisted contact tracing model. The first step of expanding public health resources is critical to the success of any tech-assisted effort. The second, third, and fourth steps are crucial to making sure resources are spent on something that is both widely accessible and is effective in identifying at-risk patients. And steps 5 and 6 ensure that technology is adopted using a privacy protective framework. First, continue the investment in and expansion of public health resources. Even if technology-assisted contact tracing works, it can only do so in the context of other public health interventions, specifically widespread availability of free and rapid testing, better equipped hospitals, having a plan and resources in place for people to safely self-isolate, and manual contact tracing, which is, it's imperative that any tech-assisted program be used in conjunction with continued and sustained manual tracing. No tech-assisted model should divert resources from known effective public health measures like testing, counseling, research, and treatment. Second, identify the specific goals and use of the technology. The likely effectiveness of different uses of tech-assisted data hinges on exactly how each is envisioned as being used in the effort to stem the spread of the coronavirus. We recommend 5 key questions to guide the planning process. What is the goal? Which data is being collected? Who gets the data? How is the data used? And what is the life cycle of the data? Third, assess and determine the technology that will be used. Generally, a tech-assisted contact tracing model is a hybrid system that relies on a staggered approach to contact tracing. It is built on the same principles of manual tracing and uses technology to enhance the process. While some of these systems could offer public health benefits, they may also cause significant risk to privacy, civil rights, and civil liberties. If such systems are to work, they must be widely adopted, but that will not happen if people do not trust them. There are 2 primary technologies that have been utilized in the context of contact tracing, which have been previously mentioned, location tracking and proximity tracking. Sorry, Byron. Pennsylvania's model uses proximity tracking, fortunately. And I'll just mention for the record, just to underscore the Deputy Secretary's point, that location tracking, which uses cell signals, GPS, and Wi-Fi to access location data, should never be used for any sort of tracing program. It's fine in using it for more aggregated data, but location data is inaccurate, nearly impossible to anonymize, and is riddled with privacy concerns. Proximity tracking, however, uses Bluetooth technology to allow phones to detect other phones that come nearby and use that to automatically keep track of who may have been exposed to an infected person. Proximity tracking generally relies on Bluetooth signals that can be sent to and from phones within 30 feet of one another. The alerts sent out through the system are not real time and only happen if a person tests positive, and they alert other users of their status via the app. Bluetooth technology can be more privacy protective because it does not require the collection of sensitive data location and stores data locally and in ways that don't identify people. This approach gained traction when Apple and Google announced a joint contact tracing effort using Bluetooth technology. Like location histories, proximity records can be highly revealing because they expose who we spend time with. But to their credit, Apple and Google developers have considered that privacy problem. So rather than tracking personally identifying location histories, apps based on the Apple and Google protocols would use identifiers that cannot be easily traced back to phone owners. Proximity-based contact tracing is currently the strongest tech-assisted proposal, though its value is still unproven. While it carries accessibility concerns, proximity-based tools could realistically meet other privacy protective principles. 4, set benchmarks for efficacy and equity. Is the technology effective? Contact tracing or related technology should be deployed only if it promises to be effective and should continue to be used only if it is shown to work. Therefore, we recommend setting publicly available benchmarks for the efficacy of the technology, factoring in accuracy, adoptability, risk of false positives and negatives, and known limitations. Is it equitable? We know that COVID-19 has disproportionately affected particular communities, and contact tracing apps that it's affected particular communities. Contact tracing apps require the use of a smartphone, which will likely exclude vulnerable and/or marginalized community members from the benefits of this technology. The use of tech-assisted technology could avoid further exacerbating those disparities by deploying additional health resources to high-risk communities and those who lack technology access. 5, identify who can access and manage the technology. Data collection should be limited and only used by public health agencies and for public health purposes related to the pandemic. And data should absolutely be prohibited from being used for any law enforcement or immigration related purposes. In other words, for any ensuring that no use of it is punitive in any way. And 6, maintaining privacy protective safeguards. For both manual and technology assisted contact tracing models, privacy protective policies at a minimum should include the following 5 elements. First is voluntary use. Any use of technology assisted contact tracing must be truly voluntary and uncoerced. Whenever possible, a person testing positive must consent to any data sharing by the app, and important public benefits like employment, public transportation, housing, and the like should not be conditioned on the use of a contact tracing app. Second, minimize and anonymize data collection. Any tracking app should be designed to protect privacy by collecting no more information than is necessary and anonymizing the information collected. 3, establish enforceable rights. Put users in control of their data by including enforceable privacy rights in the terms of service agreement with companies providing the technology. I do provide a long list of my written testimony, a list of recommended protections to include in a term of service agreement. 4, any tech-assisted contact tracing system that targets a particular epidemic should not last beyond the particular disease it targets. And 5, transparency, oversight, and accountability. We strongly recommend establishing independent auditing and oversight measures to ensure that any tracing app is used solely for public health, operates as intended, and is limited to the duration of the pandemic. And we encourage the adoption of a proactive transparency policy that includes the full public release of contracts related to the development of the technology, audits, and agency guidelines governing the treatment of any information related to the tool. These policies at a minimum must be in place to ensure that any tracking app will be effective and will accord with civil liberties. But even if these tools are adopted with appropriate safeguards, it is important to recognize that they are far from a silver bullet. They will not resolve testing shortages, which are essential to notify individuals to determine if they have in fact been infected. They will not ensure individuals who are infected get adequate and equitable treatment, and they are not a substitute for clear guidelines for the public to determine what they can do to better protect themselves, their families, and their communities. These tools can only be part of a broader health strategy that resolves these and other significant issues. Thank you.
Thank you, Ms. Randall. Mr. Skorup.
Yeah, thank you. And I'll read from my prepared remarks. Good morning, Chair Phillips-Hill, Minority Chair Carney, and distinguished members of the committee. It's a pleasure to be with you again. My name is Brent Skorup, and I'm an attorney, technologist, and senior research fellow at the Mercatus Center at George Mason University. It's commendable that lawmakers are prioritizing public health in response to the COVID-19 crisis. And I would add, like the other panelists have pointed out, and as they know, traditional contact tracing apps, and diagnostic testing must work together to be effective. But as I'll point out, I hope Pennsylvania does better, but other states who have done this have run into problems. Using contact tracing apps like the one proposed for Pennsylvania should be voluntary. Lawmakers should know how they function, and users should know what information is collected and who will use it. That said, caution is warranted. The public is skeptical of using these apps. While the app under consideration doesn't track user location, the public is wary of public health surveillance, and acclimating residents to public health surveillance has long-term social effects that are difficult to assess. I wish to make 2 points today. First, contact tracing combined with modern technology can slow the spread of viruses. Second, however, absent a major increase in testing and diagnoses with innovative symptoms, contact tracing appears unlikely to control coronavirus spread. I was cautiously optimistic about contact tracing when the COVID-19 crisis first hit the United States. Many of us observed, for instance, South Korean officials successfully used contact tracing and technology to identify and quarantine thousands of people infected from an outbreak from local hotspots. However, my optimism about contact tracing has faded as time has passed. First, the coronavirus is too widespread to control it nationwide as South Korea did. As a physician advisor to the South Korean government told reporters, once COVID-19 proliferates, contact tracing and tracking patient movements, quote, become meaningless, end quote. Second, we've learned that outside of East Asia, no country seems to have the public health norms, procedures, and technology in place to use contact tracing effectively for COVID-19. In South Korea, for instance, contact tracing for each person can often be completed within minutes, largely because of the country's experience with the MERS epidemic in 2015 and with SARS. South Korea has a centralized data platform that allows public health officials to access a patient's GPS, CCTV surveillance, travel and medical history, and credit card purchase history in minutes. South Korea also has a publicly accessible website that records people who have been infected with COVID-19, including age, gender, and other information. Notably, they haven't done this with contact tracing smartphone app. Quite simply, the United States doesn't have similar technology in place, nor is it clear that the American public or constitutional law would tolerate the kind of surveillance we've seen in South Korea, Singapore, and other countries. In comparison to South Korea, US public health surveillance is at an early stage, and experiences in other states that are doing contact tracing suggest our expectations should be modest. Difficulties with contact tracing include a lack of adoption of contact tracing apps, undertrained contact tracers, and a lack of cooperation when people are contacted. Though the app under consideration in Pennsylvania is designed to protect privacy, people are wary about using technology they're unfamiliar with. In France, for instance, the Wall Street Journal reports that less than 3% of French residents downloaded the contact tracing app. Despite nearly 2 million downloads, only 14 people have received a notice of possible COVID-19 exposure. Similarly, in Utah and South Dakota, less than 3% of residents had downloaded the contact tracing app. The New York Times has covered New York City as it unveiled a contact tracing app and hired a few thousand contact tracers beginning in June. The news is dispiriting because the program is disorganized. As one hire told the New York Times, quote, "It seems like they hired all of us to say that we have 3,000 contact tracers so we can start opening up again, and they don't really care about program metrics or whether it's a successful program," end quote. So any program will need good training and good metrics. While processes in New York City have improved since June, only about 40% of people interviewed this summer have provided tracers with the name of even a single contact who may have been exposed, a response rate that experts regard as too low to be effective at preventing spread. This is not a New York City only problem. In Houston, only about half the people contacted are cooperative. According to public health officials, people resist providing useful information about where they were and who they may have exposed because they fear, among other things, the economic effects of their workplace or neighborhood bar or restaurant being shut down. It's a difficult social problem that hinders effective virus control. Perhaps the most serious problem undermining the effectiveness of contact tracing in the United States is the delays in diagnostic testing. Recent news from California, for instance, records that it takes 6 to 9 days for a Californian who has tested positive to receive a call from a contact tracer. As one professor at UC Berkeley put it, those delays, quote, essentially negate the point of contact tracing, end quote. And I looked up the numbers in Pennsylvania, and it appears the state labs do have pretty quick turnaround, but they're only used for very high priority contact tracing. But the national labs have pretty severe delays. Health models published this month from the Lancet suggest that if people receive their diagnoses 3 or more days after showing symptoms, even perfect contact tracing performed without delays is ineffective. Effective contact tracing, researchers say, requires rapid testing of people and alerts about results, ideally within 1 day of symptoms. COVID-19 contact tracing apps must be prioritized with these immediate realities in mind. I live in Virginia, and when the state unveiled its COVID-19 tracking app a few weeks ago, I downloaded it and turned it on, doing my small part to assist public health officials and contact tracers in my state. However, for contact tracing to be effective, diagnostic tests need to be fast and accurate. According to the researchers who published in the Lancet earlier this month, per their models, minimizing testing delay had the largest impact on reducing transmissions, and access should therefore be optimized. Access to testing should be optimized. They conclude, quote, a contact tracing strategy that has potential to control virus transmission, but only if all delays are maximally reduced, end quote. Quite simply, the US federal government and state governments currently have not shown that they have the public health infrastructure and technology in place to effectively do contact tracing for COVID-19. This is not a criticism of federal or state lawmakers or public health authorities. A few East Asian countries that were prepared for contact tracing and public health surveillance had learned the hard way from their experiences with MERS and SARS crises. Nor should lawmakers stand by passively. Viral pandemics have hit the United States before and will unfortunately strike again. I trust with leaders like those on this committee holding hearings like this and acting on them, technologists, public health authorities will be better prepared in the months and years ahead. Thank you for the invitation to testify. I look forward to answering any questions.
Thank you very much. If I may, I'd like to follow up with a few questions. Ms. Randall, you spoke about transparency, about policy, about audits, about an exit strategy. And know that your parent organization, the National ACLU, has done a lot of work evaluating other states. In the work that you have been doing, I'm not clear on what Pennsylvania's exit strategy is. I don't understand what the criteria are. I don't know how we're going to get there. Do you have any suggestions from other states, perhaps who have identified key metrics to determine their exit strategy?
That's a good question, and I can certainly I can contact our national office to see if they have any particulars in terms of, I thought your question was a good one earlier to the Deputy Secretary in terms of what criteria to look for in exit strategies. I think part of the, contact tracing is really most effective when you don't have the kind of widespread, like the community spread that we're currently experiencing in the United States. It tends to be much more effective when community spread has died down and you're looking to kind of nip in the bud any outbreaks so that you can get people isolated and quarantined. And so in some ways, I think, whether certainly, some metric might be the adoption of a vaccine, but that also is going to require widespread delivery of the vaccine. But I would imagine that it's not something that would probably taper off. I mean, it would probably actually be most effective once our community spread gets more under control and we're able to put out any particular wildfires or brush fires for that matter. But I can get back to you if there are specific metrics that we've recommended and that other states have deployed or that other ACLU affiliates might be asking from their departments of health.
I would appreciate that, in that I don't believe that any Pennsylvanian wants a continuous, unending surveillance program that people consent to, thinking that it'll be until a virus epidemic is over and then find out that it's gone on in perpetuity. So I think that would be really important. And similarly, in terms of audits, can you speak to the audit procedures that have been put in place in Pennsylvania? Because I'm still not really clear that there is a third-party entity that's independent, that's not been involved with the creation and the running of this app, who will be coming in and doing an independent audit, a true third party.
Right. I mean, I think from what the Deputy Secretary had mentioned in terms of MIT, I'm aware of the program that they are working with within sort of a foundation, and they are separate entities, but I am not familiar enough, and nor have I seen specifically what the auditing protocols look like and what the segregation of even within, I mean, I think, look, educational institutions are certainly big enough that I don't necessarily, it's not an automatic presumption that they would have a conflict of interest just because they both tend to be, they're both housed within MIT, but I don't think without additional information about what that includes, I think you're absolutely right in requesting specifics on the auditing and the third party status.
Thank you. Mr. Skorup, many Pennsylvanians are waiting days before they even hear that they have a positive test result. And many of those same Pennsylvanians are then as I asked earlier, not hearing from the Department of Health as a follow-up for what they should be doing in order to, protect their own health and those around them. On top of that, because this is a novel virus, hospital systems have implemented their own policies and procedures. And it seems to me that the only way something like a contact tracing app could even be effective is to have continuity of care across the state and a standardized plan and process for how positive cases are handled. Is this your opinion as well?
Yeah, thank you, Senator. As you said, and as I noted in my testimony, according to Lancet modeling, it's critical that diagnoses are reported and people are alerted to their positive tests very quickly, ideally within a day of symptoms. And that's a lot to ask. I mean, this is new for all of us, but to get control of spread, that's what the Lancet models indicate. And this is an overwhelming problem, and I expect the state and others are prioritizing those high risk populations like seniors and nursing homes.
And I would think that you would essentially need to eliminate any delays in testing and test results in order for any type of system to be effective. Is that what you found in other states as well?
Yes, thank you, Senator. As rapid as possible. Pennsylvania's delays are not unique to Pennsylvania. This is a nationwide problem of trying to get alerts to people of their testing status quickly. As I said, from what I've read of news stories, the state labs of Pennsylvania are actually pretty quick. However, they are overwhelmed, like most states, and the national labs are responding fairly slowly.
So are there any specific examples from other states utilizing a similar technology that have been successful? You spoke of Utah. There was only a 3% utilization rate. Are there other states that have done this well that we should look at?
Senator, it's pretty early. I believe there are 5 other states using the Google Apple API that was described earlier. And these are all in the past few weeks. Virginia was the first, and it's too early to tell. But with those low adoption rates, public health experts are not optimistic. As I said, 3% in many nations and many states is not going to cut it. At the high end, you do see, I think it was mentioned earlier, in Germany, there was 20% adoption. I believe Norway had about 30% adoption, but still the numbers you've seen floated around, you want 60% adoption, ideally. Although, again, this is new for all of us, and we're all trying new approaches.
Thank you. I'm not sure who can best answer this question, but let me put it out there. There are 3 technological issues that come with the rollout of this new app. First, many Pennsylvanians lack access to high-speed broadband internet. Second, our population is increasingly trending older and may not engage or utilize a cell phone app. And then there are many low-income residents who perhaps can't afford either a cell phone or a smartphone. So can you explain how these challenges might add to the existing challenges of rolling out a program like this in the midst of the pandemic? And how might the Department of Health address those challenges?
I'll take a quick shot at that. I think, that we mentioned that, or I mentioned that specifically in my testimony about those challenges. And certainly, what we've seen with coronavirus is not necessarily that it has created, although it has, but in addition to creating new disparities, it has uncovered existing ones and exacerbated them in many instances. And so I think it's important to underscore that any kind of technology assisted contact tracing app in this instance is really, it can absolutely cannot be used as the sole mechanism for contact tracing. It has to be used in conjunction with manual tracing and all the other efforts that we are doing in terms of all of the public health initiatives that we have surrounding the coronavirus. And so, we recommend that there are additional resources that are provided to those communities who may be underserved, who might lack access. The problem, of course, is that some of them are hugely challenging. I mean, there are, I think I have in my testimony, 24 some odd million people in Pennsylvania lack access to broadband. People who are 30% of individuals earning less than $30,000 annually do not own a smartphone. Over 40% of the individuals over age 45 do not have a smartphone, which population that accounts for over 3/4 of COVID-related deaths. And people with disabilities are 20% less likely to own such devices. And so, clearly this is using an app like this is meant to be an additive as opposed to a replacement for traditional methods. And so, where we just would want to make sure that our preference certainly would be that any resources that are available go into the standard, continue to fund the existing infrastructure for the public health response to the pandemic, and not necessarily just using it to bolster the efforts of a contact tracing app.
And thank you, Senator. I would echo what Ms. Randall said. The contact tracing app should supplement traditional mechanisms of doing contact tracing. And part of that is because, as you know, and others in this committee know, broadband is not covering all of the state, particularly rural areas, and particularly seniors, those who are most affected by COVID-19, and that's a difficult problem. So I hope that the app will be used to supplement traditional contact tracing because of the wariness of seniors of using new technology, and everyone to use new technology, and also some of the broadband adoption issues that you mentioned.
Thank you very much. I'd now like to recognize Chairman Carney for questions.
Thank you, Chairwoman. I think we might have I've been listening, and I think we might have a nomenclature issue. I thought the app, basically the whole point of it was not contact tracing, but was exposure notification. And exposure notification, as I understand it, would be just one piece to the contact tracing, which would need to happen. Does anybody have a comment about that?
Thank you, Senator. Like you, I'm not, the nomenclature is difficult. I see these typically used fairly interchangeably, and what the exposure notification is doing is what's traditionally done by contact tracers, which is notify people of their possible exposure to others. I'm open to, like you, I'm not clear on what the difference is. I think it's just to make it clear that this is a new app with somewhat new capabilities.
Right, but I guess my point is it's a new app, but it's kind of a blunt instrument. It doesn't have any of the nuance that's required to try to tease out. It's saying, there's a very good chance that you've been exposed to COVID-19. You should go get tested. It seems to me that that's the prime use for.
Yeah, I agree, Senator.
Thank you, Senator Carney.
Okay, because we have broadband not only.
I will ask if any other senators have any further questions.
Phillips-Hill.
Senator Carney, we're having difficulty hearing you.
about now? Is it any better?
That's much better.
Okay. I was just going to, just continue my comment that we know there are real issues out there in terms of broadband is definitely an issue in our rural communities, but it's also an issue in our urban communities as well. Even when the broadband is there, it doesn't necessarily mean people can afford it or can use it. And these are bigger issues that we need to, I think we're working on and trying to really push through. In terms of people's, whether or not they'll actually make use of the app, I think the more we can talk about it specifically about what it actually does and try to quell people's fears, I think the better off we'll all be in the Commonwealth. So thank you, Senator.
Thank you, Senator Carney. And certainly this committee is working to pass legislation that would help address some of those same concerns. Well, I would like to thank everyone for participating in today's hearing and thank our panelists and those senators who've participated. And I now recess the Senate Communications and Technology Committee to the call of the chair.